really appreciate all of you joining today for our session over the course of the next 45, 50 minutes. We are going to talk about top compliance, regulatory and business risks facing your healthcare organization, and really just give you kind of a snapshot of some things we are seeing out in the industry now through our travels and our work with clients and others, as well as just hearing what others are saying as well. By way of background, I am Scott Sissel. I head up both our health system segment as well as internal audit services based out of Minneapolis. Primarily work with our larger clients. I'm joined today by Rachel Pugliano, who's a senior manager and focuses her time in revenue cycle consulting as well as compliance area. So today our plan is to, as I mentioned, to just discuss the key or emerging risk areas in the healthcare world. Certainly risks vary by type and nature of your organization, and the risk level can also vary by your structure and the controls in place. So today we'll go through a variety of items, and it's certainly something for you to take back to your organizations as you do your risk assessments, risk evaluation, internal audit plan, compliance plans, or enterprise risk management programs. These are just some things for you to consider. Topics today, we've got quite a bit on the menu for today, so we are going to move through the slides fairly quickly. And to some extent, I wanted to leave some of the slides and information on the slides for takeaways by you for reference later on as you get back to your day-to-day responsibilities. But the hope is we really provide some context and some background for you as you evaluate risks in your organization. First topic we're going to cover, and this is really going to be handled by Rachel, is regulatory landscape as well as billing and coding. As we've again done some of our work and heard from others, this seems to still pop up as really one of the top risks, certainly in the top 10 and maybe in the top 2 or 3 areas of concern or risk to healthcare executives. And so we want to give you a little background on this area and what we're seeing as far as key risks. And with that, I'm going to pass it over to Rachel.
Well, thank you, Scott. So as Scott mentioned, we'll be going through some of the risks associated with billing and coding and talking a little bit about the compliance process. The OIG is definitely the entity that really sets the stage for an organization's audit and compliance plan in the regulatory environment. There are also other focused audits conducted by Medicare and Medicaid, but we'll be spending time really just focusing on the OIG pieces of this. We will also shed some light on the compliance programs and areas within the revenue cycle to be aware of. So let's just talk a little bit about the OIG Work Plan itself. It's long been the main resource for alerting organizations to what efforts we should be focusing on at the federal level and also the audit activity within healthcare in general. One challenge most recently has been that there's been a change from an annual or a biannual update to the plan to now there are monthly updates. And it presents some challenges for organizations to keep current on the initiatives and how that would impact that audit plan going forward. Most of us will schedule out our audits for the entire year. And now with the audit plan being updated on a monthly basis, we're having to allow ourselves some wiggle room or some flexibility rather to incorporate some of the new topics that the OIG puts into their plan. And here's a few highlights that we've noted from the last 6 months. Malnutrition coding in the inpatient setting, so this would be a DRG payment. That's something that has been pretty consistent to remain on the plan. Device credits, so those would be the refunds for any malfunctioning devices and ensuring that those are not passed to Medicare. The payment window for PPS hospitals, that's been on the plan pretty consistently as well. In fact, I was just looking at what was on the plan for August, and this is still in the plan. Home healthcare compliance billing, that's an area of focus, as well as provider-based billing versus freestanding. There's differences there to be aware of and to make sure that we're billing those correctly for each of those settings. Also, wage index and the direct, indirect medical education and outlier payments is another focus. And also just recently in August, facet joint injections or procedures is a new item that just came on the list. So I just wanted to add that as well. Just as a reminder, ensure your organization has a policy around ensuring those providers that are excluded from the program, that they are not providing services to your organization or care to your patients. This is usually handled in the credentialing area within the organization, but should be monitored, and there should be a clear process in place for identifying these providers. So we'll just talk a few minutes here about the compliance program itself. Compliance programs in healthcare have been around since the mid-90s, so we're probably pretty familiar with these. And there are elements within that compliance program that we want to make sure we incorporate into our organization. We have some of them listed here, such as ensuring that there are policies and procedures in place, and this would also include the code of conduct or the standard of conduct for your organization. Identifying and designating a compliance officer and a compliance committee, developing the audit plan, also ensuring that there are open lines of communication. So this could be in the form of a confidential hotline, a phone number, an email, or some sort of way for employees to communicate compliance concerns. Ensuring that there's a training and education program. Also, the monitoring and auditing process should be in place as part of your compliance program. And responding to any concerns. So you have that hotline set up, but then also making sure that there's a process in place to respond to those hotline calls. And the enforcement of any disciplinary standards. So once you have that call and once you investigate it and respond to it, is there disciplinary standards in place to ensure that that is handled appropriately? The education plan is also important to have as part of your compliance program. And just that general definition of roles and responsibilities, like I said, the oversight for the plan, the assessment process, and then also assessing that the program is effective is a key piece of this as well. So as you know, the demographics of the workforce change, and the generation involved in compliance from its inception to retiring, some things might fall by the wayside, which can lead to a decline in the overall effectiveness. So this is why part of the program should be assessing that as time goes on. So these items are really the basics that I just listed, and we realize that smaller facilities may have some challenges in achieving some of these components. But one thing to consider, and we'll get into this more here in a minute as well, is even just conducting some quarterly billing and coding audits as part of your assessment and education plan. This can lead to you finding additional gaps in areas where maybe there's some compliance issues and risks that should be considered. Also, just as an FYI, your local MACs offer free webinars, which can help in assisting obtaining education for the organization as well. So definitely research and look for free education that can fulfill the requirements for your compliance program. So some areas that I just want to highlight here when it comes to revenue cycle and compliance. And what I'll really be doing is focusing more on the mid-cycle of the revenue cycle here with these particular bullet points. But for each one of these, there's just some questions to consider asking yourself and those within your organization. Is how confident are you with the organization's ability to be successful in any one of these areas? How engaged are your clinicians in understanding charge capture? Are the clinical areas held accountable for their charges, or is there a lot of rework or cleanup being performed on the back end, which then would ultimately impact your coding and billing revenue cycle function? One thing too is, how robust is your clinical documentation improvement program? And have you analyzed the effectiveness of that, as well as looked at implementing an outpatient CDI program? Consistent coding and billing reviews can point to opportunities within the revenue cycle. Some examples of that would be if you're conducting a chart review and you're noting that everything looks great in the emergency department except for maybe your drug. Well, that might lead you to do a deeper dive into pharmacy charging and billing. Or the same may be for cath lab procedures. Maybe you do an overall assessment of surgical procedures, but find that there's an issue in the cath lab that you need to focus some energies on. Another area that we find tends to be a challenge for organizations is the coding of infusions and injections, the drug administration charging. And maybe you'll have one area of the organization, such as the cancer center, that seems to have it down really well. But you might find that in another area of the organization, they need some additional assistance there with getting those billed correctly. So a lot of times having some regular and consistent coding and billing reviews can help pinpoint these areas, and then you can focus on those a little bit more. The other thing to think about is, when was the last time you had a charge master review? A lot of times we see that a charge master review might be performed when you're getting ready to implement a new electronic medical record. And that's a great time to do that. Make sure all the charge lines in the charge master are cleaned up. But one thing to do is, after that system or upgrade has been performed, then has there been a follow-up to that charge master review, and ensure that all of the charges that were set up correctly to begin with are still flowing through the system as you expect them to be. A lot of times a new system may simply just have some new and different charge capture screens. And sometimes the mapping of those charge capture screens may not be exactly correct. So doing a follow-up charge master review or charge capture review can find some of those areas within the mapping of your new system that might need to be addressed. Another area that we like to look at is, who has the ability to assign modifiers in the organization. If you have too many people that have the ability to assign modifiers or change a modifier, that can cause a lack of consistency, and we find some errors in that area, mainly because sometimes some of the individuals that are assigning modifiers may not completely understand the documentation requirements that are needed to support that modifier. So there are some modifiers that we definitely suggest only be assigned by a coder, because they have the ability to review the medical record documentation and ensure that the documentation itself supports those modifiers. So these are just the items that we've bullet pointed here, but they're not mutually exclusive. For example, an evaluation of your charge master and those line items could also include a charge capture component. A lot of times those go hand in hand. And it's a good idea to actually ensure that while you might have a beautiful looking charge master and everything is perfect, is everything actually flowing through the revenue cycle, and specifically through that charge capture and coding process, and ultimately landing on the bill exactly the way that you would expect it to, and that is accurate. So that's why we encourage a charge capture component to a charge master review. It can also give you a high-level review of just the general coding and clinical documentation in your medical record. If there are deficiencies in the documentation, if you're charging for things that the documentation doesn't support, or vice versa, maybe you're potentially missing some charges. So that might clue you into either a charge capture issue within the department, or it might even be an electronic medical record issue. Sometimes you might find modifier assignments are potential issues, and we might have those hard-coded in the system, or they might not be crossing over effectively. So those are just some ideas and some areas that you might find additional risk with by performing some of these coding and billing reviews or a charge master review. So we have a polling question.
All right, our first polling question here, true or false? Clinical documentation is one of the hotspots for regulatory compliance.
100%. Well, yes, absolutely. Clinical documentation is key with really all of the revenue cycle pieces that we've touched on just a few moments ago. So absolutely. I'll turn this over to Scott. Thank you.
Appreciate your Rachel for that discussion. Obviously, that's just the tip of the iceberg when we look at some of the risks that are out there. The next topic is really around specialty revenue streams, and what we've seen out there is healthcare organizations certainly are dependent on revenue from government and other payers, but we're also seeing emerging areas of contracting. Not only on the payment side with different payers that include things such as incentive arrangements around cost, quality, or other factors, but also arrangements that may include unique bonus provisions or compliance requirements, or entering into new arrangements, or having certain departments or divisions that maybe are outside of the core, acute care, hospital type provision of care. And these things can create compliance issues that can be challenging for a variety of reasons, due to their complexity, due to the data requirements, or simply because they're not part of the overall corporate structure, control structure, or compliance structure, and don't get the attention that other areas may get, or they may be outsourced. Billing, coding, monitoring, management might be outsourced to other areas. In particular, in the health system area, we see things such as pharmacy, emergency room, home health, physician practices, ambulatory care, psychiatry, dental, senior living probably should be on the list. All those type of areas are outside of maybe some of the core services or core inpatient services. And while they may be overall controlled at a corporate, from a corporate perspective, many times they are not, or they're the control structure or management is outsourced. What we see from an issue perspective is they can be subject to various government attention. Rachel gave an example of home health earlier that certainly could be part of increased government attention. The pharmacy area and opioid use, another area that is receiving significant new attention. And we also see internal resource limitations, complexity of process as being an issue, along with the fact that our opportunities being maximized because of those reasons within the organization, maximizing revenue opportunities or growth opportunities. I think the thing that we see is the concern is really, what do you know what you don't know? Because of the nature of these organizations, or because they're either new or situated in a different function or control structure. First thing I'm going to talk a little bit about is the incentive arrangements that may be in place. Some of the things that I'm sure all of you are experiencing now or seeing is things like bundled payments, capitation arrangements, pay for performance, shared savings or shared loss arrangements, risk pools or risk scoring, particularly those that maybe have health plans as part of their organization or are moving into the Medicare Advantage area. Been a lot of discussion and news articles about the risk scoring process. Joint venture arrangements are interesting as well, given the relationships oftentimes with the JV entity and the ability to understand exactly all the different compliance or contractual requirements. And the questions you may want to ask yourself is, in all these, is the data being captured at all? And if it is, how comfortable are you with the data that you're getting with respect to these arrangements? And is the information, do you have the ability to review it for accuracy and reconciliation to the system? The other thing I'd add is, do you have a clear grasp, does your organization, I should say, have a clear grasp of all the contractual arrangements in place, and whether You've got a good monitoring process to ensure that all those contractual compliance provisions are being tracked and monitored, whether they have a financial effect or whether there's some other compliance related impact to them. The next topic, so that was kind of a brief overview on specialty revenue, and I think our point there is a lot of these areas are continuing to grow and expand, and sometimes they're outside the corporate control structure, so it's important for organizations to ensure they're monitoring those relationships and that they're comfortable, they have a good, clear understanding of the different provisions that may come into play. And again, as I think as part of your risk assessment, looking at those type of relationships are important, and in particular, joint venture relationships, certainly as we see more organizations entering into these and maybe even moving into more dynamic areas such as technology companies or relationships with payers, those things become more important. The next item I'd like to spend just a few minutes on relates to reimbursement and related issues. This area, similar to the topic Rachel presented on, is really something we will often put together, and we recently have and will in the future, a whole session just on these areas because it does get to be fairly complex. What I want to touch on today is just a few key points. Certainly the regulatory changes occurring have driven by rising medical costs, and some of the political dynamics going on now are putting the spotlight a little more on Medicare reimbursement and compliance and related regulations. And within your organizations, you know, the relative tightness on margins means it's important for you to maximize opportunities as much as you can, as well as staying compliant. Certainly within the Medicare cost report, it's important to understand compliance and also understand some of the key areas in order to maximize your reimbursement opportunities. And 4 areas I'm going to touch on real briefly today relates to S10 schedule, related uncompensated care, 340B, which we'll talk about a little bit later, as well as bad debts and wage index. S10 uncompensated care, it's certainly an opportunity for increased reimbursement. It's subject to a fairly complicated worksheet that calculates the hospital's uncompensated care cost. And not only is it subject to complex calculations, but it also has 3 levels of factors, some of which are calculated by CMS. In addition, this has been an area we see a bit more focus on from an audit perspective relative to these particular calculations. Fiscal intermediary is now using 2015 Medicare cost reports to establish the hospital payment percentage. And I think a couple points to make on this is when performing, when calculating this, it's important to make sure your schedule is correct. It has been subject to audit. Contractors now tend to be asking for items such as a reconciliation of total bad debts to the financial statements or working trial balance, detailed listing of claim charges and payments that needs to match the cost report, and also understanding the logic and process for querying the hospital charges. I provided a link here for you to go to if you want a little more information on that after the fact. 340B, I've got a couple slides towards the end. I think most of you probably realize there's a significant opportunity here in the drug price discount pricing program that are out there. With it comes a fairly high level of compliance requirements and related provisions. One thing to keep in mind, I'll make a point here, is that it is subject to certain percentages of DISH based upon type of organization. So for PPS hospitals, it's 11.75% DISH percentage that you should be meeting, and for sole community hospitals, it's 8%. So we think it's important for you to continue to monitor that on a regular basis so you do not fall out of compliance with those provisions. Next topic is bad debt. This is an area that where Medicare continues to pay a percentage of the hospital bad debts, Medicare bad debts, and we tend to find that there's still some gaps, and maybe hospitals not claiming all the charity care as bad debt that you could. So an area to keep in mind. There are some criteria for bad debt and charity care eligibility related to the debt being part of a covered service, obviously for Medicare or dual eligible patients. It's also required that there are reasonable collection efforts, and that when the debt was actually claimed, it was truly worthless, and that there's sound business judgment used relative to the bad debts. So it's important to have that consideration in place and documentation for that. But fiscal intermediary audits are becoming more detailed. So you may want to make sure to include more detail as to the write-off within your support. The final item, and I've got a couple slides on this, is wage index, and it is really one of the few areas you can significantly impact future Medicare payments. What we found is that facilities maybe aren't working together as much as they could to maximize their opportunity here, revenue opportunity, and to increase their average hourly wage rate, excuse me. And by way of a bit of background on that area, wage index really reflects the relative hospital wage level for each geographic area compared to the national average. Geographic areas are based upon core-based statistical areas defined by OMB, and data used to calculate the wage index is aggregated amongst all the PPS hospitals located within each CBSA. So again, that's really why it's important to make sure that not only are you maximizing your wage index, to the extent there's some strategy to within a geographical area to raise that wage index, that means that everyone would have an opportunity to increase their wage index. Any of you that are in the below the 25th percentile wage index in fiscal 2020, you have an opportunity for additional reimbursement that's built into the regulations. Why review wage index? Wage data, it directly impacts reimbursement. It's often the last schedule completed, and so the question is there as much effort put into it? It is complex. It is reviewed closely by these agencies such as CMS and the MACs, OIG, et cetera. So it's important to make sure that's done accurately. Areas to review, payroll file, making sure you've got a complete payroll data as well as hours that go in and that your hours and payroll are consistent. Contract labor, there's some opportunities that potentially contract labor may be or should be included in your wage index calculation, along with certain benefits, benefit allocations, and pension. So all those things should be reviewed to make sure you've got a complete composition of your calculation in your schedule when completing your wage index analysis. And again, those are some things that can have some direct impact on your reimbursement. A couple other areas I'll point out here, and I won't spend a lot of time on there. Outlier payments, Rachel mentioned, is subject to increased audit. There are some unique provisions there relative to outlier reimbursement and the provisions of what is allowable or not. However, in reviewing those closely, I think there's also opportunities for additional reimbursement in looking at those outliers. Low volume adjustment is kind of a unique ACA rule that's created an add-on payment. Low volume adjustment is subject to being to discharges, less than 3,800 total discharges for a fiscal year, and also a 15-mile requirement. So again, it's important to make sure you're taking advantage of that if it applies. And if you are getting that add-on, to make sure you're monitoring to make sure that you're continuing to be in compliance with that. Next polling question around risk arrangements. Amy, you want to take that?
Sure. Polling question number 2 is now open. Multiple choice there.
Okay, very good. Yeah, arguably, I would say number 1 and 5 would apply. Question is fee for service. I think some of you that answered yes to fee for service or all above probably are looking at it. Some fee for service arrangements have certain risk arrangements built in. So, so kind of a trick question there. But anyway, appreciate responses, and we will move on to the next one. Cybersecurity. A lot of you probably have heard this over and over again, and I actually questioned whether I put anything in here. I did, mainly because I think this is an area that just continues to be a fairly high risk area, and everything we've seen from other surveys done and by executive groups is still very high on people's plate. You know, interesting, this slide probably would apply maybe 3 or 4 years ago, where, you know, some people would go, what, me worry, you know, it will never happen to me. I think in the healthcare world, that isn't necessarily the case anymore. There's just been so much activity and press about it, and I think all of our organizations are continually battling data hacking attempts on a daily basis. Some information that shows kind of the uptick, and this information is really what's reported to HHS. In 2015 to 2017, a 2-year period, there was 392 data breaches reported. 17 million patients were impacted. From the period January 2018 to just recently, not quite a 2-year period, that's increased 25-30% from an incident standpoint, and the number of patients affected were much more significant. So it's continuing to be a significant issue. The costs are extensive. Data breach costs are roughly 3.5 million, and that's probably increasing as well. Medical information tends to be more valuable than other information such as credit card, because people, the thieves, if you will, can use the data to order healthcare equipment or drugs and then resale. They can submit false claims with insurance companies, as well as other opportunities. We've seen things in the payroll area at several healthcare organizations where certain payroll schemes have been in place to divert money from a payroll perspective. So a lot of activity in that area. Why is it important? Obviously, health information is very valuable. I've highlighted cloud, and this is something that maybe isn't necessarily considered or thought of by a lot of people, but the cloud is just another server. And it's a server that's outside of your 4 walls in a shared service environment. And you know, we've certainly seen the use of cloud through a lot of EMRs now, arrangements. But what's been interesting is in healthcare organizations, it's not unusual to have 10, maybe hundreds of cloud arrangements throughout the various functional areas of an organization, where they've accessed a certain type of cloud computing technology, and oftentimes the risks and even the inventory of where those risks are and the number of arrangements in place aren't as well known as maybe they could be. So that may be one takeaway, to go back and just understand what your exposure is to the cloud right now, along with other entry points. Challenges for healthcare providers, certainly acquiring and retaining experienced IT resources is a challenge. Certainly other industries, technology industry, commercial industry, tends to probably pay some of their employees in this area more, so trying to retain and recruit those people can be a challenge. Limited funding for cybersecurity mitigation is a challenge. There's a significant reliance on third-party vendors, and third-party management is certainly a whole nother topic that we could get into, but it is of critical importance and risk. Increased reliance on technology, not only in some of the administrative functions, but in actually providing care, makes healthcare a bit different than other organizations, along with the fact healthcare organizations are dealing with PHI. And then from a leadership level, oftentimes some of the more seasoned leaders on the board or management level just don't have that background or experience in IT, given kind of where they've been in their career. So that certainly creates some gaps and risks. Some thoughts for you to take away. Cybersecurity should be a regular topic of discussion at board and executive level, and I always like to make the point that, you know, as we go to board meetings or understand what's happening on monthly management meetings, they're always going to talk about the financial results. They'll probably be talking about legal exposures. They'll be talking about operations, volume, quality issues. But oftentimes that cybersecurity or information technology update may only happen once or twice a year. And I think we see in best practice organizations that's become a more regular discussion topic, where there's more dialogue and more plain language English around that. We think management should be involved in the risk strategy around cybersecurity, not only developing that strategy as far as risk assessment, but also monitoring the plan to mitigate the risks, ensuring that the culture and the organization has ongoing training and testing, and understanding that cybersecurity is not just an IT challenge, it's really an enterprise risk or enterprise-wide challenge for everyone in the organization to look at and take ownership over. So anyway, some thoughts there. A couple of kind of interesting things, and I'll skip through this slide. These are some areas that may be at risk, but in a recent survey by Journal Accountancy, it was interesting that internal audit leaders viewed that only about half viewed that they had confidence in their cybersecurity expertise. And down at the bottom, only 17% of respondents indicated that their business continuity plan clearly provided for data breach and cyber attack procedures at all. So certainly some opportunities for improvement there. One other interesting note, a researcher at Vanderbilt University actually did some research and provided some correlation between data breaches before and after a data breach and the increase in mortality rate. So I'm not saying that this is right or not, but he had some correlation to the fact that data breaches can be distractive and could result in quality of care issues as well. So anyway, something to think about as you go back to your offices. Another polling question. Amy, if you want to jump in there.
Sure thing. Polling question number 3. What is the average cost of a corporate data breach?
Okay, most of you got it correct, 3.5 million, although as I mentioned, that number is growing. So, you know, I'm sure that there's been many situations where it's greater than 10 million as well. So, okay, next section, just a couple comments on mergers and acquisitions. I know we've only got about 15 minutes here. M&A activity continues, both from hospital and system to system level. There's also been more arrangements around physician practices, payer relationships, joint venture relationships, things that kind of move down the technology side of things. These areas tend to be outside maybe, again, the core service area of an organization or their core skill set. And so I think it's really important to, as an organization moves into mergers, a new merger or acquisition, that they're really understanding the risks and that their due diligence process considers things like legal, compliance, contract review, and convergence of contracts between the organization and that organization, technology and how that integration works, a clear integration plan so everyone understands integration of the organizations, both from an operations standpoint and a control perspective, and also understanding the human resource plan and a cultural assessment. And cultural assessment encompasses ethics, compliance, risk tolerance as well, and ensuring both organizations are aligned relative to their risk tolerance. Again, cross-functional teams are important to ensuring all that are synced up and considered from a risk perspective. And as I mentioned, what risks are we assuming? And I think one of the items to consider is what type of risks are you taking on? You know, we talked about billing and coding. Are you assuming risks of that organization for previous issues that they may have had, known or unknown? And so I think it's important to understand that on the front end. Next topic, data analytics and artificial intelligence. This is certainly a hot topic. You hear about this just about everywhere, and I put it on as a risk area only from the perspective of how do you keep up and with your competition and make sure you get the most effective and efficient organization. A recent forum of healthcare executives, one of the CEOs quoted that we have to do this. It's a question of how much we can afford and how quickly we can implement it. Certainly there's an opportunity to leverage data to manage health and drive decisions, and we see many examples out there. Mayo and Google have recently came out with some discussion about using artificial intelligence to improve care delivery and outcomes. Apple and the Apple Watch has been certainly something that the press picks up on quite a bit. United Healthcare and their Optum division has done a lot of things, and there's multiple other organizations that have been looking at the healthcare area as an area that's has a high opportunity for use of data analytics and artificial intelligence. I think what we've seen, and even in this recent healthcare executive group, they said, well, there's a ton of opportunity in per se the operating room or operations. The initial opportunities are probably going to be more in that handling patient record area, administrative support, and fraud prevention. And I think what our thoughts on this are, first of all, the Institute of Internal Audit came out with some recent papers on data analytics, and they recommended starting slow and trying to create some successes. There's really 4 different areas or 4 different stages of analytics: descriptive, diagnostic, predictive, and prescriptive. Certainly the prescriptive side is very complex and area of artificial intelligence and data analytics. I think a good goal is to start slow, try and use data analytics to help with the diagnostic and predictive area. For those finance people out there, we've seen it used in the accounts payable area, payroll, accounts receivable, and really looking at anomalies or unusual relationships, unusual activity that may trigger some follow-up as to that activity and ability to monitor some of the costs and revenue in a more deeper fashion and a more predictive fashion than what you've been doing in the past. So again, there's a lot out there on this. I think it's an area that there is a fair amount of opportunity in, and so I would urge you to continue to look at how you're using data analytics and to improve efficiency and reduce risk within your organization. Tax compliance, I've got several slides here. I'm really just going to hit a couple points. In the not-for-profit healthcare world, I think this is an area that sometimes isn't as much of a focus as it could be. And I think what key point to note is there still tends to be a significant amount of scrutiny in this area. And I think it's important for organizations really to make sure they've got a process to consider all the potential tax risk areas that are out there. There are certain areas that we'll talk about today. Enormous of benefit, private benefit are subject to intermediate sanctions, and it's important to support the compensation provided to various individuals or within your organization so that you don't run into intermediate sanction issues. Lobbying, there's some strict restrictions on lobbying efforts, and since we're back into the presidential campaign season, it's important to recognize that. Same with political activities, both from a direct and indirect basis. So I think it's important for your organization leadership to understand the restrictions related to that. UBI risk also continues, and it's important for you to monitor all your UBI activities. We've seen more activity in the audit around unrelated business income. Within the new rules, there's additional rules around the siloing effect and making sure you're not offsetting losses with income from another organization, and making sure you're monitoring when you can group organizations into these silos. You can certainly consider restructuring to avoid exposure in this area as well. So certainly talk to your tax advisor around those particular areas. Community health needs assessment, which is subject to 501R. We've, again, IRS is actively reviewing compliance with these rules and are performing examinations. We've seen activity where fines and penalties have been assessed. Billing and collection policies are also getting more scrutiny. Some of the politicians have certainly raised the flag around certain organizations' billing and collection policies, and it's important that they be reasonable and not be overly aggressive, that they're reasonable and appropriate, and that you're not going to extreme levels to collect payment before submitting to charity care policies. And I think it's important for you to continue to review these policies on a regular basis and make sure they're publicly available. A couple other areas to point out that oftentimes aren't considered: payroll tax issues and some of the various limitations such as FICA. I think we've seen some issues there, particularly in a multi-organizational situation where they've got multiple entities in place, and some of those allocations and calculations maybe aren't being performed appropriately. Foreign reporting obligations, particularly for all alternative investments, apply, as well as the other one I'll point out is state and local taxes for multi-state organizations or organizations that perform services cross-state, and so it's important to look at your state and sales and use tax, property tax requirements, and make sure you're in compliance with those areas as well. The Tax Cuts and Jobs Act, I'm not going to spend a lot of time on that other than to point out certainly it's reduced some of the tax rates there, but there are some hidden issues that have been bandied about, particularly UBI and its impact on transportation, qualified transportation, parking, and on-premise athletic facilities and benefits that have been provided to employees have been kind of a unique and unusual provision that's, I think, caught some people off guard. These are some other takeaways you can take back around charitable contribution impacts and advance refunding to make sure you're looking at some of the exclusions and limitations that are in place with respect to those. Next polling question: true or false? Amounts incurred for employee fringe benefits may be treated as UBI. The answer is true. I went through that quickly, so I understand if people may have missed that one, but yes, they could be considered UBI, particularly with some of that transportation, parking, or other benefits provided. So again, if you're unsure about that, we'd certainly be able to be happy to talk to you or have one of our people talk to you more so on that. Cultural and conduct assessments. I think the comment I want to make here is this can provide a lot of value to your organization, and it's outside, and many of you come from a finance world or internal audit or compliance world, and there's certainly a way to assess your culture in a variety of areas: ethical, customer service, cyber awareness, risk identification, culture. And oftentimes that's been honed by human resource department, but we see the benefits of reviewing your culture in other areas as well. Consumerism continues to be a high risk or a high focus area of healthcare organizations. The consumer experience is extremely important. And so we've seen different organizations conduct, whether you call it culture or conduct studies to see how well they're positioned to make sure their interactions are easy, convenient, timely, and cohesive to fit into the patient's daily activities. And that's more so than just the physician interaction, the nurse's interaction. It has to do with scheduling. It has to do with the individual who meets and greets the patient and their family. It has to do with the interaction with people in your billing and billing area. All those type of things kind of feed into the consumer experience. And so there's some things that certainly can be done around that to understand where the organization is to provide a superior customer experience. So anyway, really quickly on that, I want to just make a couple comments. But I think we're seeing consumerism and culture being, you know, one of the hot buttons in the healthcare area. Supply chain and related operational areas, just maybe 2 or 3 comments on it, and I'm going to tie this a little bit more into the inventory and pharmacy costs. Data analytics is really something that can really help in this area. You obviously need to have good controls in place around quantity, access, and purchasing controls. But I think you can build some data analytics around turnover rate, utilization, obsolescence, and write-offs to ensure a couple things. You know, there's theft is not occurring, utilization makes sense and is reasonable across the organization. And also you can monitor things such as certain pain medication, the opioid situation, by building data analytics around usage by area, physician, provider, etc. And so anyway, I think the point there is keep that in mind as you look at supply chain and operations. There's some real opportunities for data analytics in that area. Well, thank you very much. We only have a minute. I'm going to just throw out one. I'm just going to hit the 340B drug pricing program. Most healthcare providers right now, I think, that we work with really have a significant impact from 340 drug pricing. The audits by HRSA are still continuing. We've got a bunch of slides that provide some detail on it. They're continuing to review compliance with the provisions. There's also a requirement that organizations have an internal audit plan in place and they document this plan. I would recommend that as you go back and are talking amongst your organizations that you, if you are accessing the 340B drug pricing program, that you do have a plan in place to perform those internal audits and remain in compliance. So that would be the other item. We still see that popping up as kind of a hot topic in the compliance area. So with that, I apologize. We're right up against our time. And again, we'll try and build out some more presentations in the future to talk about this in more detail. Amy, I'll throw it over to you.
Awesome. Thank you so much. So we did have just a few questions come through, but we will, I'll get those to the presenters and we will get those answered offline for you. You have connection information here for our presenters if you do have any questions. Thank you all so much for attending, and thank you to our presenters. So have a great weekend, guys.
Thank you. Have a great weekend.